Hi, my name's Dr. Peter Landsberg. I'm one of the doctors at arthritisCARE. I'm just going to be speaking to you briefly about some diseases, and the first disease I'd like to talk about is rheumatoid arthritis. Rheumatoid arthritis is a very common condition that affects up to 1 in 90 people in the world. It affects more women than men, but affects everybody, children to old people. It's a disease where the immune system suddenly takes a vengeance against the joint tissue and other parts of your body. White cells, which normally should be protecting you from viruses, germs, cancer cells, suddenly turn feral and will start attacking your joints. And the joints become painful, tender, red, swollen. Sometimes it just affects one joint, but often it affects every joint in the body. It generally leaves the spine alone, but every other joint is fair game. People often think they just have a bad virus for a few days, but the condition just gets worse and worse and worse. Often people feel quite tired, unwell, even get the odd rash and fever, so it's easy to see why it might be thought it's a virus at first. But it just doesn't go away and it gets worse and worse and worse. Once upon a time, treatments were terrible. When I first qualified as a doctor, all we had was high-dose aspirin and really toxic drugs like gold. Natural things do help. Medicines like fish oil and turmeric can relieve the pain, but the goal now is to really turn off the disease. Rheumatoid can also affect other parts of the body, so it really is that these white cells don't just finish with the joints and sometimes can move to other parts of the body like the lungs, the eyes, the skin. When it's very active, the disease can make you very, very tired and just feel awful. Many people have to stop working, often have to stay home. It can be very, very disabling. It can affect, even in young babies, will stop feeding, not being able to walk, weight bear. Older people will have to go to hospital sometimes because they're so disabled. The condition is similar to many, many other autoimmune diseases, and I'll talk about some of those in a moment. The classical signs are a person will walk through the door or limp through the door with terribly swollen feet, fingers, wrists, elbows, feel very sore and stiff, particularly morning stiffness. Often people have trouble getting out of bed, have trouble getting up off a couch and just moving once they've been sitting or lying down for a while. The joints will look warm and pink and red and be very tender to touch. Medications are very effective now in turning off the disease, and once we turn off the disease, people go back to a normal life. The challenge is to find the right medicine for each person. So at last count, there are over 20 different therapies for rheumatoid arthritis. So the challenge these days is to find the right therapy for each person. It's like finding a pair of shoes to fit your feet or a suit to fit. The treatments are very individualised now. There are gentle treatments right through to incredibly powerful treatments, really depending on how severe the disease is, how early you get the disease, and just the person's own response. We expect now for people to become completely well, although occasionally, even well people will have the odd flare. Similar to things like asthma and so forth, where people can be very, very well but still have to use their puffers from time to time. Folk who with rheumatoid are stable can still have the odd flare and need a bit of extra treatment. The term we now use is treat to target, and the target is for people to be pain-free, fit and well and have no signs of the disease. When people aren't treated well, the disease can damage the joints, and in fact tissue can build up in the joint which actually eats away the bones and the ligaments, and many patients who've had the disease since the 1950s and 60s will have very destroyed joints. In my clinic I'll have new patients who look completely well and normal, and older patients from 30 or 40 years ago who have quite damaged joints and have multiple joint replacements. So there's been a tremendous change in treatment and expectations of outcome in the last 20 or 30 years. So we really encourage early diagnosis and early treatment. The faster we start treatment, the quicker people get better. And our expectation is for people to become completely better and lead a normal, healthy life. Have children, play sport, travel, but still have to keep in touch with their doctor just to make sure that things are going well.